Good afternoon, everyone, and welcome to our session on Medicare and how Medicare interacts with your UCSD healthcare plans. Many of you may have already participated in the Medicare 101 seminar, which we offered a couple of weeks ago with Ryan Hislop. That seminar was totally focused on the basics of Medicare, how to sign up, what the penalties are if you don't sign up at the appropriate time, things like that. Today, our presenter, Debra Wells, will do a little bit of an overview of some of those basics, but then she's especially going to be focused on how Medicare relates to your UCSD healthcare plans. This is part of our regular series, which we offer every fall and every spring of senior seminars. We have another senior seminar coming up tomorrow, and that is estate planning. And so we hope you will be joining us for that session as well. Will everyone please remain on mute during the presentation, and then when we get to the Q&A session, we will ask you to unmute and you are also welcome to put your questions in the chat during the session if you have questions as we go along. So today our presenter is Debra Wells. Debra is a great friend of the UCSD Retirement Association. She serves in an ex officio fashion on the UCSD Retirement Association Board of Directors and does an excellent job keeping us all up to date about everything UCSD healthcare. Debra serves, as I said, as the UCSD Healthcare Facilitator. And in that role, you need to know that the Healthcare Facilitator is open to retirees as well as current staff and faculty. So even though you're retired, if you have a problem with something with your healthcare, Debra Wells is your UCSD point of contact. And at this point, I'd like to turn the mic over to Debra Wells. Welcome.
Thank you, Suzanne, and thank you all for being here. Let me share my slides. Can you see now?
No, we see you, but not your slides.
Oh. No, it's not. Oh, let's see now. Okay, how about now?
There we go. You're up bright and clear.
Okay, great. So let's go ahead and get started. So today I'm going to just briefly go over the basics of Medicare, what UC requires of you as you age into Medicare or family member ages into Medicare, the premiums, how UC determines the premiums, how your current plan coordinates with Medicare, and then I'm going to give you some tools and resources to have. So just quickly, the basics of Medicare, just if those of you who maybe didn't attend the seminar, it's a federal program that provides health care for individuals age 65 or older that have earned their 40 credits. Under the age of 65, if you're disabled, and that's determined by Social Security. And then if you have been on SSDI, Social Security Disability Income, for 24 months or more, or have been diagnosed with end-stage renal disease or kidney failure. There's two agencies when it comes to Medicare. You have Social Security and CMS. So when it's time for you to apply for Medicare, you want to contact Social Security. If you want to know what your premiums are going to be, contact Social Security. Or if you have your Medicare card or need a replacement card, you'll contact Social Security. But for everything else, you'll be contacting CMS. CMS can answer things like what's covered by Medicare, or you get your evidence of coverage booklet or evidence of explanation of benefits, and you want to know how they processed a claim. That's when you contact CMS. If you haven't received your booklet from Medicare, you'll contact CMS. So when it comes to Medicare, there's 4 parts of Medicare, and all of UC's plans cover everything that Medicare covers. There's only one plan that does not cover prescription benefits, and I'll go over that later. So Medicare Part A is your hospital coverage. Part B is your outpatient, your medical coverage. Then I'll skip over to Part D, that's your prescription drug coverage. And then Part C, which is Medicare Advantage, that's when A, B, and D are all looped into one plan. Listed here is the rates, the premiums for 2021 for Medicare. Most of you have worked and you have earned Medicare Part A for free. You have worked 10 years or more, paid FICA taxes, so you've earned your 40 credits and don't have a premium to pay. We do have a group of individuals who did not pay into Social Security, so they weren't earning credits. If you ever wanted to apply or pay for Medicare Part A because you didn't earn it for free, if you have 0 to 29 quarters or credits, it will cost you $471 per month. If you have anywhere from 30 to 39 quarters or credits, it will cost you $259 per month for Part A. For Part B, it's determined by your income. And Social Security always looks 2 years back. So in 2021, they're looking at your income in 2019. And it's based on how you filed. Did you file an individual tax return or did you file a joint tax return? Once you find what your bracket is, what applies to you, you just carry it over to the right, and there you will find what you will pay for Medicare Part B or Part D. Most will earn Part D for free as well. It's only those with higher incomes that may have a Part D premium to pay. When can you apply for Medicare? If you're aging 65 for the first time, that's your initial enrollment period, and it runs 7 months long. 3 months before you age 65, the month that you age 65, and 3 months after. And then you have your special enrollment period. That's for individuals who worked past the age of 65. When they get ready to separate or retire, they're in their special enrollment period. And then the general enrollment period is for, it happens at the same time every year, and it's from January through March 31st. Hopefully none of you will ever have to apply for Medicare during your general enrollment period, because that tells me that you missed your initial and you missed your special enrollment period, and you might be subject to penalties. That's just a brief overview of Medicare. When it comes to Social Security benefits and Medicare benefits, the experts really are the Social Security Administration, CMS, Centers for Medicare and Medicaid Services, or HICAP, Health Insurance Counseling and Advocacy Program. And I'll have that information listed for you at the end of the presentation. So what UC requires of you? When you're retired, Medicare and applying for Medicare and enrolling is no longer an option. If you're eligible for premium-free Medicare Part A, you're required. You must enroll in Medicare Part B. If you don't qualify for Medicare for free, the university doesn't require that you enroll in Medicare Part B. Okay? Failure to comply may result in penalties, and it will be a permanent loss of your UC-sponsored medical coverage. There's only two exceptions, and that's for those who retired prior to July 1, 1991, or those who live out of the country. Because UC knows that Medicare doesn't cover services out of the country, they don't require that you pay for Medicare premiums. But if you ever move back and you change your address with the university, they are going to require that you enroll in Medicare. And at that time, however long you've been out of Medicare when you should have been enrolled, according to them, they will apply a penalty, and that's your penalty to pay. There's nothing the university can do about that.
Wow.
So a question that I get a lot is, why am I required to enroll in Medicare if I'm covered under a UC plan? Well, UC relies on Medicare to offset the cost of insurance. Retirees over the age of 65 without Medicare cost twice as much or more to insure for the university. Medicare partially reduces the cost, which keeps UC premiums affordable and allows UC to continue health benefits for retirees. When it comes to Medicare Part D, that is your outpatient prescription drug benefit. Like I mentioned before, all of UC plans have prescription coverage included in our plans, and it's considered creditable coverage. The formularies, though, may vary. So if you're in a non-Medicare plan now into Medicare, just know the formulary can change. Enrollment into another Medicare Part D plan will kick you out of UC's plan. So you can't have two Part D plans. If you're in a UC sponsored plan, do not enroll in another outside prescription drug plan. And when you get ready to age into Medicare, know that you must take action because there's a form that every member must complete if they're on a UC plan. The UC Medicare prescription drug form. The drug form that you will need to complete is determined by the plan that you're in. So if you're in UC Blue and Gold, the form you need to complete is UBEN 121. And the plan that you will transition to is UC Medicare Choice PPO. And I'm going to go over all the plans in more detail later. But this slide here is just to let you know, whatever plan that you're in, as you or a family member age into Medicare, each Medicare family member must complete and must sign their own form. One thing I want to mention is the last plan at the end. If I have anyone attending today and you're in the UC Health Savings Plan, we don't know which UBEN form you're going to complete because you have to first choose another plan if you are a family member age into Medicare. So just know, choose another plan and then complete the necessary form. I just want to show you the timeline on what you can expect when it comes to aging into Medicare. UC will notify you or send you a packet 90 days prior to your 65th birthday. In this example, I'm using a retiree that is aging 65 in the month of April. So 90 days prior, they're going to start getting communication, letters, and instructions on what they need to do. They'll have 3 months to contact Social
Excuse
Security.
me, there are people who aren't muted. Could you make sure?
Thank you. So 90 days, you'll have 90 days to contact Social Security, apply for Medicare, receive your Medicare card, complete your UBEN form, and get it to RAS. If in the month you age 65, they scan their system and they do not have your form on file, that's when the penalty will start. They will penalize you every single month, $419.60 until you get your form submitted. If you're someone that doesn't qualify for Medicare, you still need to show proof. You can get a denial letter or some statement showing that you're not eligible, and you have to get that over to RASC. So how are Medicare premiums paid? If you're collecting Social Security income, they will automatically deduct it from your Social Security benefit. So expect that deduction, expect your Social Security income check to go down. Social Security will send you a Medicare card approximately 90 days before your 65th birthday. And if you're, they'll give you an invoice letting you know what your premium will be. If you're not collecting Social Security, you need to start applying again 3 months before. And there's 3 ways you can do it. You can apply in person. That may be a little different now because of COVID, so contact your local Social Security office. You can apply online, and that's what most people are doing at this point. Or you can call Social Security. That is also the time you will be setting up payment arrangements. It's called Easy Pay. You want to make sure your deductions for Medicare are paid on time, because they will notify the university that you haven't paid or you stop paying your Medicare premium. And then that's when the university will send you a notice and start the penalty process. If you're not eligible for Medicare because you did not pay into Social Security, you may qualify if you're married under your spouse's work record. So if you're currently married and your spouse is age 62 or older, make sure you apply for Medicare under their work record. If your spouse is not yet age 62, you need to remember to apply for Medicare when they do age 62. Most retirees don't remember to do this at the age of 62 because they associate Medicare with the age 65. And now when you apply for Medicare under your spouse's work record at the age of 65, you're hit with a 3-year penalty because you were first eligible at the age your spouse, age 62. If you are currently single, not married, if you're single, but you were previously married 10 years or more, you could qualify under your former spouse's work record. And again, when they age 62. It's very important for you to know what UC requires of you when it comes to Medicare, so you're not subject or hit with any penalties. Everything that I'm covering today can be found in this Medicare fact sheet, and it's available on UCNet. Retiree health premiums. So when it comes to your retiree health premiums, it's based on the number of years you work for the university, UCRP service credit years, not employment years, but UCRP service credit years. Also the level of coverage. Are you covering just yourself or self plus adult or family? It's determined by the medical plan you're in, whether or not you're eligible for Medicare. If you need to know what the current premiums are for this year in 2021, I included the link here. You can find them on UCNet. I'm not going to go over the next few slides. I only included the premiums just so when I send this out or ask Suzanne to send this out for me, it'll be included in the presentation. So just briefly, when all family members are in Medicare, these are the rates for 2021. And this is for someone who worked 20 or more years of service. If you work less than 20 years, know that whatever you see here, your premiums are going to be higher than that. And then there's when one or more family members are not eligible for Medicare, which the university calls a split or mixed family. Okay, so these are the premiums here. And then on UCNet, you'll find that the premiums for retirees when you're not eligible for Medicare because you're not 65. And then there's that special bracket for those age 65 or older, did not pay into Social Security, do not qualify for Medicare. So when you log on to UCNet and you're looking for what premium you will pay, make sure you're looking at the correct bracket. And then I just want to give you a breakdown of how those premiums are paid, or how UC comes up with the premiums. So if you look at the red square, a lot of times employees or retirees think that because they earned 100% of the UC contribution, that means the university is going to pay 100% of the full premium. And that's not the case. You earned 100% of the maximum UC contribution. So in this example that I'm using, I have a self plus adult, not in Medicare. The premium that the university is charged is $2,330.98. Because this individual earned 100% of the UC contribution, UC will pay 100%. So $2,330.98 minus $1,630.60, the premium is $700.38 for that family of two not eligible for Medicare. But as this family ages into Medicare, you will see here, now the university for this family of two, both in Medicare, is only charged $913.40. The maximum UC contribution is $632.54. So $913.40 minus $632.54 comes up to $280.86. So I just want to show you that as you age into Medicare, you will see your premium start to go down. And the reason your premium is going down is because UC knows you're paying for your Medicare Part B. And then in this slide, I'm just showing you the difference between someone who has 20 years of service versus someone who has only 10 years of service. Because they only earned 50% of the UC contribution, the UC is only paying half of the maximum. So $2,330.98 minus $815.30, the retiree's premium is $1,515.68. That same family of two that's eligible for Medicare, UC would pay half, which is $316.27 from the $913.40. The retiree pays $597.13. So I hope that kind of helps you understand how the premiums are determined. So remember to go log on to UCMet to find out the current cost each year. Now, coordination of Medicare and your UC sponsored plan. No matter where you live on this earth, the university has a plan for you. It just may be delivered to you in a different way. So if you are retired and you still live in the state of California, these are the plans available to you. The retiree drives the plan for their family members. What's listed in the black print are the non-Medicare plans. What's listed in the red print are the Medicare plans. If you were to move out of the state of California, in a state, these are the plans that are available to you. But once you and all family members are eligible for Medicare, now your benefits will go through VIA benefits. And I'll go over more about VIA benefits later. Again, this is only for retirees living in a state outside of California, and all family members are in Medicare. Should you live abroad? Because UC knows, again, that Medicare doesn't cover services abroad, they don't require you to enroll in Medicare. And the only two plan options that offer worldwide coverage for an unlimited stay is UC Care and Core. These two plans are PPO plans, and they offer worldwide coverage. So let's first go over the Medicare and HMO plans. First of all, the Medicare and HMO plans, when you have the two, they're considered Medicare Advantage plans. So once you have Medicare Part A and B, and you're enrolled in an HMO plan, you're going to have to assign your plan, your Medicare, to your plan. Medicare pays a flat rate to the insurance company. Medicare cannot be used separately from the Medicare Advantage plan because you've assigned the two together, you've joined them together. If you have a family where some are eligible for Medicare and some are not, that's considered split or mixed family. The non-Medicare family members will be listed here, while your Medicare family members will be here. So if you're in UC Blue and Gold, the Medicare family members will be in UC Medicare Choice PPO. If you're in Kaiser as the retiree, your Medicare family members will be in Kaiser Senior Advantage. So here's just a breakdown of Kaiser and how it works and what changes when you age into Medicare. Listed in the middle column, you already know how Kaiser works because you probably have already been in that plan. So I'm just going to show you in red what changes. The inpatient code stays the same, but the ER copay goes down, goes from $125 to $65. The prescription drug benefit stays the same. The difference with eyeglasses, where it once wasn't covered for you as a Kaiser member, once you age into Medicare, you now have vision benefits built into the plan. So any Kaiser Senior Advantage member may not need the VSP plan. We have some retirees who choose to keep both. They keep their VSP plan in addition to having their Kaiser benefit built into the plan. The behavioral health benefits change. With Kaiser members, as you age into Medicare, the Optum benefit is no longer an option. For Kaiser members, you have both Kaiser and Optum. Kaiser Senior Advantage, only Kaiser Behavioral Health. And one thing I want to mention about Kaiser, if you have behavioral health services and you had services by an Optum provider, you have to make sure that you take that prescription if you're given a prescription to the Kaiser pharmacy. The hearing aid benefit, it goes up. You have a $2,500 allowance per ear. Kaiser Senior Advantage has the best benefit when it comes to hearing aids. Acupuncture, the copay goes up $5. You pay $20 when covered as medically necessary. And it's chiropractic services. It goes up $5 to $20 and covered when Medicare covers the services. The out-of-pocket maximum for Kaiser Senior Advantage members is $1,500, and that's for medical services. For prescription drugs, the out-of-pocket maximum is separate, and it's $6,550. Most individuals on Kaiser Senior Advantage, they never meet the out-of-pocket maximum because of the copays. Our copays are pretty low. And also for Kaiser members is the Target Clinic. No authorization necessary. If you go there for preventive services, it's zero copay. Non-emergency services, you have a $20 copay. What's new for this year is Kaiser Senior Advantage is now available in the Fallbrook area, and I've listed the zip codes here. Also Kern County, and I've listed the zip code here. And on this slide, the same thing. What will change if you're in this plan, UC Blue and Gold, and you age into Medicare, or your family member ages into Medicare, just know what's listed in red will change for you. Again, the ER copay goes down, prescription benefits remain the same. The hearing aid allowance, instead of 50% up to $2,000, you get the first $2,000. So if the hearing aid costs $1,000, under the Blue and Gold plan, they're going to pay 50%, only $500, 50% up to $2,000. But under the UC Medicare Choice plan, they're going to pay the first $2,000. So that $1,000 hearing aid, they're going to pay the full $1,000. The acupuncture is $20 for 24 visits, but it's each benefit. Under the Blue and Gold, it was a combined benefit. You get 24 visits total for acupuncture and chiropractic services. But under the Medicare Choice plan, you get 24 visits for acupuncture, 24 visits for chiropractic services. The telehealth vendor changes. Under Blue and Gold, you have Babylon that is our vendor for telehealth, but under UC Medicare Choice, you would use Amwell or Doctor on Demand for your telehealth services. Under the Blue and Gold plan, it's an HMO plan. That means you have to select a primary care physician and you have to have all services within your medical group. You cannot go outside of your medical group, without authorization. When you age into Medicare, your family members that go into UC Medicare Choice, it's now open access. You can go to any provider you want as long as they accept Medicare. So you're not locked in or assigned to a specific medical group. One thing you want to do when you age, when you age into Medicare, you want to make sure that the provider that you're treating with accepts Medicare. The annual out-of-pocket maximum, it goes up. For medical, the out-of-pocket maximum is $1,500 for medical services, and for prescription, it's $2,000. The annual out-of-pocket maximum means that once you reach your out-of-pocket maximum, now your plan will pay 100%. So you reach your out-of-pocket maximum on any of our UC plans, the plan then pays 100%. Other options for medical care under the Blue and Gold plan, you're able to use Minute Clinic, and it's at inside of select CVS pharmacies throughout the United States. It's available in 33 states, but the UC Medicare Choice, because you have open access, you can go to anyone, any urgent care or standalone type of clinic for urgent or emergency type services. So now for Medicare and your PPO plans, the plans that are administered by Anthem Blue Cross. So with the PPO plans, you're not assigning your Medicare to your plan. It's your supplement plan. It's your secondary plan. So Medicare will pay for services as primary, and then they will automatically send your remaining balance to Anthem Blue Cross, and Anthem Blue Cross will pay as secondary. Just remember to always use Medicare approved providers. So again, if you have a split or mixed family, those who are in the non-Medicare plan will stay in their non-Medicare plan, but the Medicare members will move over to the Medicare coordinating plan. So if you currently have Core, you will transition your Medicare family members to UC Medicare PPO. If you have UC Care, your Medicare family members will also have UC Medicare PPO. Remember in the slide before, I mentioned that if you have the UC Health Savings Plan, it's incompatible with Medicare, so you have to select a new plan altogether. So currently with UC Care PPO, again, it's worldwide coverage. You have 3 tiers. You have UC Select, you have your in-network, and you have your out-of-network. The UC Select here is when you're accessing services at a UC facility, a UC provider, meaning UCSD Health or UCLA. Any UC provider, you would be in the UC Select tier. But if you go outside of UC, but they're contracted, for example, Scripps. Scripps is contracted with Anthem Blue Cross. So they're considered in-network. If you go to an in-network provider, you'll have to first meet your deductible. And then after that, the plan will pay 70%. You will pay 30% for most services. Outpatient services, office visits, you pay 30%. Preventive care is not subject to the deductible. You have a 0 copay. Inpatient, you'll pay 30%. The emergency room copay is a flat $300 across the board, whether it's a UC, contracted provider, or non-contracted provider. Urgent care for in-network is $20. Most services this year, if you're in this plan, you probably remember last year you only paid 20%. Well, this year it went up. You now pay 30% of services if you're in this plan. The prescription drugs are the same, whether you're UC Select or in-network. You're also able to get a 90-day supply at Costco, CVS, Safeway, Bonds, or Walgreens. The out-of-pocket maximum is listed here. One thing I didn't mention in the UC Select here, there are some services where there's no UC Select benefit. So make sure you're reviewing your evidence of coverage for any limitations, exclusions, or anything not covered under the UC Select here. And sometimes you may have multiple copays if you have this plan. The out-of-network benefit is for any provider that you see that doesn't have a contract. Your deductible does go up. Individual is $750. A family of 3 or more is $1,750. If you see a non-contracted provider, you will pay 50%, the plan pays 50%. But the plan is only paying 50% of the usual and customary benefit, not 50% of the bill. So whatever they pay as usual and customary, their 50%, you'll pay the other 50% plus any additional charges that the provider wants to bill. So just keep that in mind. Under Anthem Blue Cross, 98% of providers are contracted with Anthem Blue Cross. So you shouldn't have a hard time finding a provider under the Anthem Blue Cross in-network contracted providers. Again, once you reach your out-of-pocket maximum, no matter which tier you use, the plan then pays 100%. So I know I say here, if you're in-network, you pay 30%, or out-of-network, you pay 50%. But keep in mind, once you reach your out-of-pocket maximum, your plan will then pay at 100%. Excuse me?
You are going to use the hands on the chair, but I want you to imagine that you don't need it.
I thought that someone was asking a question. I'm sorry. So for Core is the other plan that I mentioned. It's a PPO plan, offers worldwide coverage. It has a $3,000 deductible, whether you're in network or out of network. Preventive services are not subject to the deductible, and it has a 0 copay. If you use a contracted provider, the plan will pay 80%, you will pay 20% for services. Hearing aids are not covered under this plan. The out-of-pocket maximum is $6,350 per member, or $12,700 for the family. Out of network, same deductible, you'll pay 20%, the plan will pay 80%. But again, when you use an out-of-network provider, the plan is only going to pay 80% of the usual and customary service. You'll pay the other 20% plus whatever the difference is.
Deborah, we have a hand up from Dan Radu. Can you take
Okay.
a question?
Yes.
Dan, go ahead and unmute yourself and ask your question.
I don't want to interrupt the presentation. I will do it at the end, but I just wanted to make sure that I'll have a chance to ask.
Okay, sure. Yes. Okay. So for, again, UC Care and Core, when you have family members or you age into Medicare, this will now be your plan. UC Medicare PPO. So you will see here, the deductible goes down. It's only $100. You pay nothing, no copay. Days 61 through 90, you will pay $70.40 per day. Days 91 or more, you will pay 20% of those services. The plan will pay 80% and you will pay 20% for most services. The copays are listed here. There's no eyeglass coverage. So if you're enrolled in this plan, you may want to consider enrolling in VSP. There's no eyeglass, no vision benefit here. Now you still get the eye exam. That's a medical service. I'm talking about your eyewear, glasses, frames, lens like that. It's not covered under this plan. Hearing aids, the plan pays 80, you pay 20%. Acupuncture, same. Plan pays 80, you pay 20%, to a maximum of 24 visits per calendar year. The annual out-of-pocket maximum is $1,500 for medical or $6,550 for prescription. Again, I have yet to see in my almost 19 years of being here, someone to reach an out-of-pocket maximum for prescription drug coverage. And for the medical piece of it, remember, as you're paying your 20% for this plan, if it should ever reach 1,500, the plan will pay 100%. For telehealth services, you still have that benefit. You pay $20 for your copay. It's worldwide coverage only up to 6 months. So if you're living abroad and your visit is going to be over 6 months long, you need to contact a RASC and enroll in UC Care or Core. I mentioned before that when you're in a Medicare plan, you must use Medicare providers. But there are services that Medicare doesn't cover where our UC supplement plan does cover. Things like hearing aids and acupuncture services. Although Medicare doesn't cover these services, Anthem Blue Cross does. In addition to these two services, Medicare doesn't cover marriage and family therapists. Some psychiatrists and psychologists don't accept Medicare. They chose to opt out. Well, the university didn't want to have any disruption when it came to behavioral health, mental health benefits. So now you can continue to see those providers, even though they don't take Medicare. You just have to contact Anthem and let them know, and they will pay 20% of 80% of services. You will pay 20%. This doesn't happen automatically either. You have to contact Anthem. And a lot of times I'm finding that the provider won't even tell you. They'll just tell you, we don't take Medicare. If you want to continue to see us, you have to pay cash out of pocket. And the member has been doing so, not knowing that there's a benefit available to them. Again, when it comes to the UC Health Savings Plan, it's not compatible with Medicare. This plan is a high deductible health plan. It's not available to retirees as a new option. So you have to have already been in this plan when you were employed. So the deductibles I listed here, you still get the UC contribution just as you did when you was an employee. So if you're enrolled in this plan on January 1st, the university, if you have self-coverage, will give you $500 in your health reimbursement account. If you have family coverage, you'll receive $1,000. Most retirees are not listed and enrolled in this plan, so I'm not going to go over this plan. If you have any questions about this plan, just go ahead and email me separately. Again, it's not compatible. It's not open for new enrollment. If you're in this plan and you age into Medicare, you must stop contributing to your HSA at the moment Medicare is effective. The other plan that's available is UC High Option, but it's only available during open enrollment when all family members have Medicare. If you have a family member that's not currently eligible for Medicare, you cannot enroll in this plan. The High Option plan has the highest premium, but the reason retirees like this plan is because they prefer paying a higher premium, because then most services are covered in full. They're paid at 100%. The deductible is only $50. If you have inpatient services, days 1 through 90, you have no copay. Days 91 or more, you pay 20%. Office visits, whether it's your primary care or a specialist, you have no copay. For behavioral health, if they accept Medicare, you have no copay, you pay nothing. But for those providers, those psychologists, psychiatrists that don't take Medicare, that's when you pay 20%. The prescription drug benefits are listed here. There's no eyeglass coverage in high option. So these members should consider enrolling in VSP. Hearing aids, again, not covered by Medicare. Anthem will pay 80%, you'll pay 20%. Acupuncture, not covered by Medicare. Anthem pays 80, you'll pay 20 to a maximum of 24 visits. The out-of-pocket maximum this plan has the lowest out-of-pocket maximum. It's $1,050 for medical and only $1,000 for prescription. So again, as you're paying these 20% and your deductible, once you reach $1,050 or $1,000 for prescription, the plan then pays at 100%. Telehealth services through Live Health Online, available for a $20 copay. It also offers worldwide coverage up to 6 months. Anything over 6 months, contact RASC to enroll in UC Care Core. One thing I like to mention, this plan, although it's one of the retirees' favorite plans to be enrolled in, I do find a lot of our enrollees are overinsured. They pay this higher premium, but they don't necessarily need this much coverage. So if you're considering enrolling in this plan, it's a great plan. I did have my mom enrolled in this plan, but she needed this much coverage. So when it's time for open enrollment, just look at your family's needs and determine which plan is best for you. For behavioral health plans, I just like to point out that depending on the plan that you're in will determine who is responsible for your behavioral health benefits. So I've listed those plans here. Another thing that I like to remind retirees that you still have access to Faculty Staff Assistance Program, FSAP. It does continue when you retire. It's free confidential counseling for you, the retiree, and your household members. All you have to do is contact FSAP to set up an appointment. Right now they're doing virtual appointments. You can also find them at this link that I've listed here. They also offer educational workshops and support groups. So again, if you want to participate, just call them, they'll send you the direct link. For Medicare retirees, when you and all family members are enrolled in Medicare and you live in a state outside of California, you will still be offered medical benefits. It's just going to be delivered through VIA Benefits. It's UC's Medicare Coordinator Program. The reason UC went this route is to give the retiree more choices that's available to you in the state that you live in, more value, flexibility, and support. UC will provide an annual contribution every year for each enrolled family member. And it's determined by your years of service credit. So if you have 20 years or more service credit, you will receive $3,000 in your health reimbursement account, and each family member will receive $3,000 in their health reimbursement account. It's based again on your years of service. Each covered family member will choose their own individual plan. Whereas if you are a retiree and you live in the state of California, you know that you pick the plan and all family members have to be in that same plan that you pick for the coordinating Medicare plan. But VIA Benefits is different. You're each individuals and you choose your own plan. So one may be in Kaiser, the other one may be in Anthem, so on and so forth. With your health reimbursement account dollars, this is what you would use to pay for your supplement plan when you enroll through VIA Benefits. Also to pay for your prescription drug plan. If you have money left over, which many retirees do, you can use it to pay for co-pays, prescription co-pays, out-of-pocket costs, or you can leave it in your account and just let it roll over. During open enrollment, one thing you want to remember is that when you move out of state, you are locked and you go into VIA benefits, you're locked out of open enrollment. So to make changes to your dental, vision, or legal plan, you have to use a paper form. Opportunities to enroll or change plans is always during a qualifying event. You move out of your plan service area. You have a newly eligible family member. You get married. You involuntarily lose coverage through your maybe working spouse. Other than that, you have to wait for open enrollment to enroll new family members or change plans. The healthcare facilitator program, it's myself and my assistant. There's only 2 of us that serve all of UCSD employees and retirees. So just know that all the resources and everything you need can be found on UCNet. But if you have an escalated issue and aging into Medicare is complicated for you, just know that that's what we're here for. We're here to help you. On this page, I listed some resources that you will need throughout, your UC retiree status. One being UCNet. Here's the link. That's where you'll find all open enrollment, evidence of coverage booklets, Medicare fact sheets, everything you need to know about your UC business or UC benefits. Also RASC. Many of you probably know this number by heart, but I've included the number, the website, fact sheet on UC retiree health eligibility rules. This is a good link to just review, refresh your memory on who's eligible under you. I've also listed CMS, Social Security, and HICAP for you here. The Retirement Association listed here. VIA benefits, I've listed the link here. Again, that's for retirees in Medicare living in a state outside of California. If you ever need to get in touch with your benefits office and you're a health employee, there's their information. If you're looking for a campus benefits contact, I've listed their information here. And again, my name, Debra Wells, here's my telephone number, my email address, and my assistant is listed here. So just to wrap it up, when it's time for you to apply or age into Medicare, make sure you start the process 3 months before aging 65, you or your family members. Medicare premiums are deducted from Social Security, or you need to make payment arrangements if you're not collecting Social Security. Every person that ages into Medicare must take action and complete a UBEN form. You need to log into UCNet to review the evidence of coverage booklet. I just gave an overview of each plan, but you need to look at the evidence coverage booklet to find out more detailed information about your plan. Always remember, open enrollment is your chance to enroll family members or change plans. And again, help is available. That's what I'm here for. I know Medicare can be confusing, but we're here to help if you need our assistance. And that's it.